Welcome back to the Wound Talk series from Molnica. In the previous episode, we learned about the 8th of our 10 essentials, controlling edema. Mary's wound is almost completely healed. She is free from pain and continuing steadily on her wound healing journey. It is important to remember that our nurse, Jane, treats many other patients alongside Mary too. The focus of our next essential is a condition many nurses come across. Essential 9, managing cavities and fistulae. This is a pressure ulcer that our nurse Jane has been treating. A pressure ulcer can often result in a cavity, and sometimes a fistula, a tunnel, can be formed from the wound cavity. It is important to assess and then manage cavities or fistula and be aware of undermining. Undermining occurs when the tissue under the edge of the wound erodes, leaving a pocket beneath the edge of the wound. A cavity or fistula needs to be managed carefully. One of those treatments is to fill the cavity or fistula with a cavity filler. These fillers need to prevent wound bridging and absorb, retain, and transport excess exudate away from the wound bed. Keep the wound moist and help prevent infections that could further impact the wound healing process. Remember, the key point is to fill the wound but not pack it. This is a subtle but important distinction. We want the cells to have the chance to heal the wound from the base of the cavity upwards. And with that, we've completed 9 out of our 10 essentials. Just one to go. Now that we have explored why managing cavities and fistulae are important, let's take a look at how we implement this knowledge into practice before we move on to our final essential: evaluating wound management and preventing recurrence through patient engagement.